President, prescription drug abuse is the fastest growing problem in the country. It's a problem that the Centers for Disease Control and Prevention classifies as an epidemic. The availability of prescription painkillers is a leading factor in the increase of opioid abuse. Since 1999, opioid abuse, overdose deaths have quadrupled nationwide. Unfortunately, my home state of Arkansas is not immune to the problem. CDC data shows that it's one of 12 states with more painkiller prescriptions than people. I repeat, one of 12 states with more painkiller prescriptions than people. Benton, Arkansas Police Chief Kirk Lane has seen the impact in his community. He said during a recent visit to my office, and I quote, "A lot of people become addicted very innocently and can't find a way back." Placing prescription drugs in the medicine cabinet for safekeeping is no longer the best option because 70% of Americans misusing painkillers are getting them from friends and family. Arkansas has implemented measures to combat this problem by decreasing the availability of prescription drugs and properly disposing of expired and unneeded medication through the Arkansas Take Back program. This is an important step that has resulted in the removal of more than 72 tons of unneeded medication from homes in the state. Congress has taken action to fight this epidemic. As a member of the Senate Veterans Affairs Committee, I pushed the Department of Veterans Affairs to reform its culture of prescription. Nationwide, pharmacies have a system in place to prevent overfilling prescriptions. It's time for the VA to adopt a similar system. I pressured the DEA, the Drug Enforcement Administration, to reform its policy to allow clinics and pharmacies to serve as drop-off sites for the collection of unused or unwanted prescription drugs. Last year, we passed legislation to improve the prevention of treatment of opioid abuse by pregnant women and care for the newborns affected by this abuse. This bill was signed into law. Congress approved more than $400 million in funding to address the opioid epidemic this fiscal year. That's an increase of more than $100 million from the previous year. Calls for additional funds for this legislation are premature. We need to see the progress and results made with the current funding. We must continue our commitment to the fighting of this epidemic and providing our communities with the tools they need to improve response to addiction and promote treatment and recovery. That's why we need to pass the Comprehensive Addiction and Recovery Act. This bill can help give communities the ability to combat the growing opioid epidemic in Arkansas and across the country by expanding prevention, supporting law enforcement, combating overdoses, and expanding access to treatment. I've heard from many Arkansans who support this bill. It has the support of many Arkansans in addition to a wide range of organizations that represent law enforcement officials, drug treatment providers, and healthcare professionals. This speaks to the comprehensive approach we are talking about that we need to take to fight this epidemic. It also authorizes the Attorney General to award grants to veterans treatment courts. These courts are critical in helping our veterans break the cycle of addiction and turning their lives around. Prescription drug abuse is a widespread problem that impacts all ages and populations of Americans. I'm committed to providing Arkansas communities the resources that they need to fight this epidemic. I yield the floor.